Diabetes is a very common condition. There's broadly speaking two types of diabetes, and it's basically usually lack of insulin in what we call type 1 diabetes, the people who are in a younger age group, usually below the age of 30. But there's also type 2 diabetes, which is in fact commoner than type 1 diabetes. And it's generally caused by resistance to the action of insulin that the pancreas is trying to produce. Very common, 3 to 5% of the population. Okay.
And what does the insulin do? If you've got a resistance to insulin, what does that mean?
Well, first of all, one requires insulin to keep the sugar at a certain level. The body likes blood sugar below 6, but having diabetes and therefore a lack of insulin or the insulin not working properly, which is what insulin resistance is when the sugar rises above 6 and generally goes up to double figures or sometimes even over 20s. At lower levels, one doesn't experience any symptoms, but at higher levels, then the patient may complain of thirst, of going to the toilet excessively, passing more water, possibility of losing weight, especially in younger type 1 type of diabetes, recurrent infections, and lethargy, because of course the body requires sugar, glucose, to maintain energy. So without that, then one loses weight and feels terribly lethargic. Recurrent infections, another one, especially in women, infections down below, is a common way of presenting. But like I said, in those individuals who have only a sugar just above normal, in the 8s, 9s, 10s, then no symptoms at all can be recognized. The problem is that sugar is a toxin longer term and can damage various parts of the body, such as the eyes, and kidneys, and nerves of the feet in particular. There's also a higher risk of strokes and heart attacks, and this is particularly so in the longer term and if people don't manage the diabetes well.
And so how do you manage diabetes then? If you've got that excessively high sugar level, I take it eating a Mars bar is probably not going to do you any good.
No, absolutely not. So diet's the main point, is the sheet anchor of treatment, really. So sugars, especially refined sugars, need to be avoided. Yeah, and one should adopt the healthy lifestyle as possible. So eating the right things without too much sugar, as little fat as possible, and take as much exercise as possible.
Can you manage diabetes in that way? You don't have to go on a drug regime?
Well, with type 2 diabetes, which is what older individuals get, then one can manage to improve their diabetes or bring their blood sugars down with an excellent diet. However, the vast majority then go on to require medication. One goes in one pill for a few months, maybe a few years, and then go into a second pill and a third pill, and then usually something injectable. We have insulins and other techniques to use these days to try and bring blood sugars down as normal as possible. Sadly, this is not always the case, and most people do not behave as they should. So complications sadly remain quite commonplace, really.
So if you're talking about managing a diet, well, is quite difficult to manage most of the time. I mean, I would have thought that the average person indulges in a little, plate of chips here and a burger there and a can of Coke there. What sort of diet are you hoping that people would have in order to manage their diabetes? I
think you've just mentioned all the things that people should avoid. I think the occasional indulgence is fine, provided it's rare and common. But if one, it's all in a balanced diet, isn't it? So one would recommend a healthy cereal as opposed to a fry-up for breakfast. There's also a question of portion size, because we're talking about individuals here who are usually significantly overweight. So instead of having 2 or 3 rolls for lunch, then you have one. Instead of having 3 or 4 large jack potatoes, then you have 1 or 2. So it's all a question about moderation, reducing the amount of carbohydrates in your diet to prevent yourself from putting on too much weight, and go for salad options and vegetables, as opposed to your Kentucky fries and your McDonald's, really.
If you saw a row of 100 people, would you be able to identify those who were likely to get diabetes? Is it that easy, or is it a little bit more complicated than that?
If we're talking about the type 2 diabetes, then no, it's not complicated, because generally speaking, the people who are overweight are the ones that develop diabetes. However, you require a genetic component as well, not just being hugely overweight, but having both a family history and a tendency to be overweight would put you at very high risk.
And how much overweight is overweight?
Well, if we talk about body mass index, that's taking height and weight into account. So anything above 25 is considered overweight, but generally we're talking about people with body mass index of over 30. who are likely to develop it. Though, of course, it can happen at... so the larger you are, the more likely you are to develop diabetes.
And if you were to lose that weight, would you lose your diabetes?
Yes, there are 2 or 3 big studies that have shown that you can reduce the risk. If you were prone to become diabetic and were overweight, you were likely to reduce the risk by the order of 50 to 60% by adopting a very healthy lifestyle. And that's people who've cut out fat from the diet, so adopted a very healthy diet, and taken exercise. And by exercise, we're talking of a 20 to 30 minute brisk walk or equivalent, at least 4 to 5 times a week.